What are pancreatic biopsy procedures for diagnosis? When it comes to diagnosing pancreatic cancer, one of the most important tools doctors have is the biopsy. But what exactly are pancreatic biopsy procedures? These medical techniques are designed to obtain small samples of pancreatic tissue. This helps confirm whether a pancreatic lesion or tumor is cancerous. Imaging tests alone, like CT scans or MRIs, often cannot provide a definitive diagnosis. There are several types of pancreatic biopsy procedures, each selected based on the tumor's location and the patient's overall health. The first and most common method is called endoscopic ultrasound-guided fine needle aspiration, often abbreviated as USFNA. In this procedure, a thin, flexible tube equipped with an ultrasound probe is passed down the throat into the stomach and small intestine, allowing doctors to visualize the pancreas. Using ultrasound guidance, a fine needle is inserted directly into the tumor to collect tissue samples. This method is highly accurate, with a diagnostic accuracy of over 90%. It is minimally invasive and generally safe, with a low risk of complications like pancreatitis. Another method is endoscopic retrograde cholangiopancreatography, or ERCP. This procedure uses an endoscope and contrast dye to visualize the pancreatic and bile ducts through X-ray imaging. During ERCP, doctors can take biopsies using a brush or forceps to collect cells from the ducts. This technique is particularly useful when tumors involve the ducts or when ductal sampling is necessary. A third option is the percutaneous biopsy, where a thin needle is inserted through the skin of the abdomen. This is guided by imaging techniques like ultrasound or computed tomography scans to reach the pancreatic lesion. This method can be either fine needle aspiration or core needle biopsy, depending on the type of sample needed. While less commonly used than USFNA, it can be appropriate when EUS is not available. Lastly, there is the surgical biopsy, which is less common today. This may be performed if a patient is already undergoing surgery to remove a tumor. Laparoscopy, or keyhole surgery, allows doctors to visually inspect the pancreas and take biopsy samples. This approach may be necessary if there is a suspicion of cancer spread or if other biopsy methods have not provided clear results. It is important to note that sometimes more than one biopsy may be needed to reach a conclusive diagnosis. While biopsy procedures carry some risks, such as bleeding or infection, these risks are generally low when performed by experienced specialists. The choice of biopsy method depends on various factors, including the tumor's location and the patient's health. Once the biopsy samples are collected, they are examined microscopically by pathologists. This helps identify cancer cells and determine the type and characteristics of the cancer. In summary, pancreatic biopsy procedures are crucial for accurately diagnosing pancreatic cancer, which is essential for planning effective treatment and managing pancreas health. Always consult healthcare professionals for personalized advice and guidance regarding these procedures.